Welcome everybody. This is our first, Julie and I, this is our first time doing a webinar, so we're excited. And we are going to speak on the topic of understanding dementia. So we're gonna give a little bit of some scientific interesting information, and then we're gonna talk about the services that we provide as care consultants. Again, good morning. My name is Jennifer Sanchez, and I am a PSS care consultant. And with that, I'm gonna turn it over to my colleague, Julie, who is going to present to you on the topic of understanding dementia.
All right, so good morning, everyone. I am Juliana Bartels, and I am another care consultant with PSS Circle of Care. I'm the other Staten Island care consultant. And yeah, so we're going to just start this right off by talking a little bit about the topic of dementia, and starting off with what is dementia. So, all right, what is dementia? So dementia is classified as a general term for a decline in mental ability severe enough to interfere with daily life. Also, it is an impairment of at least two functions. So typically that is an impairment of memory loss and judgment. It's also known as the decline in ability to perform what we refer to as ADLs and IADLs. So those are typical activities of daily living or instrumental activities of daily living. So your activities of daily living would be things such as bathing, grooming, typical bodily care, and IADLs are a little bit more involved. Those would be typical public functions. So things such as shopping and maybe not just public, but more involved activities, things that are instrumental to our lives. So cooking and doing activities in the home, such as cleaning, laundry, driving, using public transportation, things like that, which become increasingly difficult if you are someone who is dealing with a memory impairment. It is a decrease in cognitive functioning, reasoning, and decision-making. All right, so we have some common types of dementia. Now, here's where I went a little bit off the rails. So here we see three of the most common types of dementia. Now, dementia is a symptom. So dementia is the symptom of memory loss. And there are many different diseases which contain the symptom of dementia. So Alzheimer's disease is the most common, and it accounts for about 60 to 80% of all dementia cases. We also see vascular dementia, which is also known as post-stroke dementia, and it accounts for nearly 10% of all dementia cases. That number has certainly fluctuated with the amount of, with the heightened amount of strokes that we see now. There is also Lewy bodies dementia, which is similar to Alzheimer's, and it has symptoms such as hallucinations, sleep disturbance, gait imbalance, which is an unsteady, when someone is unsteady on their feet, and it often gets misdiagnosed as Parkinson's because there's a lot of Parkinson's symptoms such as tremors. Now, I also do want to note some other types of dementia. There's also mixed dementia, which combines two or more disorders, and one of those disorders being dementia. One of those would be Parkinson's-related dementia, which would be Parkinson's disorder and dementia, or Alzheimer's disease and Parkinson's. There's also frontotemporal dementia, which is noted by an early onset, usually between the ages of 45 to 65 years of age. And it's also noted by very jarring behaviors such as hypersexual behaviors, loss of filter, and drastic personality changes. There's also dementia related to Huntington's disease, Creutzfeldt-Jakob's disease, Wernicke-Korsakoff syndrome, which is related to a severe thiamine or vitamin B1 deficiency. And yeah, I'm pretty sure those are the ones that I have written down. I could go on forever, but let me not. All right. So because people are living longer, their risk of being diagnosed with dementia increases. So we're going to talk about a few risk factors. These are certainly not all of them, and none of these guarantee anything. You know, more and more research is being done every day, but these are just some risk factors, not currently listed on the screen, but I'll go over them. What we see here is that age is the greatest risk factor for dementia. And every 68 seconds, someone in America develops Alzheimer's disease. Currently, 5 million people in the US are living with Alzheimer's, and an estimated 250,000 New Yorkers are diagnosed with AD. Okay, and some other risk factors are genetics, diet and exercise, so related to blood pressure and high cholesterol, smoking, alcohol abuse, diabetes, severe undiagnosed anxiety and depression, traumatic brain injury, and poor sleep pattern. Okay, so now we are going to go into the different stages and kind of what to expect with Alzheimer's. And we're going to focus on Alzheimer's disease
Sí, ¿con quién
because
hablo?
that is the most common.
Hola, Cecilia. Sí, ¿cómo estás, amor? Gracias. Oye, estoy en una llamada de conferencia. ¿Te puedo llamar de vuelta?
All right.
Dame el teléfono.
So, all right, so
Bueno,
with
llámame en una hora.
Alzheimer's.
Gracias, chao.
Let me just make sure that, okay. Muted me.
Okay, go ahead. Sorry.
Yeah, no, just only unmute me.
Can you hear me, Julie?
Yes.
Okay, I think we're good to go.
Okay, perfect.
Sorry for that.
Just to decrease some of the background noise. All right. Okay, so with early stage Alzheimer's, some things to expect are some difficulty doing routine activities, some subtle short-term memory loss, so dementia, a failing sense of direction. So what you may notice with loved ones is getting lost, going to places that they would typically go to, let's say a doctor's office or a friend's house, and misplacing items. So let's say putting the milk away in, the china closet, or, putting the cordless phone in the refrigerator, and, that happening more and more frequently. So at this stage, the care receiver, so what we refer to the patient as the care receiver. So the care receiver can still understand the implications of their illness and can still articulate concerns. So they can still express that they may have concerns. All right. So next, the middle stage of Alzheimer's disease. We would see increasing cognitive impairment. So cognitive functioning is becoming more and more impaired. There may be some problems with recognizing friends and family, especially people that they don't see on a daily basis. So someone that they may see once a month or maybe only a few times a year, they may have difficulty, or maybe there would be some difficulty recognizing or putting voices to faces. So speaking with someone over the phone and recognizing who that person is. There may be some communication difficulties, so the inability to find the word and replacing that word with something else, what we refer to as word salad, and notably mood swings. So concerns include loss of control, fear of abandonment, and frustration. So those are just some feelings that the care receiver may be going through at that time. All right, and next we have late stage Alzheimer's. So at this stage, the care receiver is no longer able to care for themselves. There's limited verbal communication. At this stage, there may be many physical limitations, minimal recognition of friends and family, and possibly total incontinence. There may be some limited cognitive ability, and what we also refer to as moments of lucidity, where there would be periods, very short periods of time where you could almost see your loved ones come through, but rarely does that happen, but still a possibility. All right, so next we're going to talk about why get a diagnosis. So first, it's where do you get a diagnosis from? So first step would be, if you don't already have a trusted neurologist, you can go to the care receiver's primary care doctor and state that you have some concerns regarding the person's memory. And if you notice some behaviors or any of those changes noted before. So from the primary care doctor, you can get a referral to a neurologist. So a formal diagnosis from a team of doctors has proven to be 90 to 95% accurate. So what does the diagnosis include? So what goes into getting a diagnosis? So what the doctors will do is they will go through a complete family history. Now the reason for that is because, as discussed before, they want to see if there may be a genetic or hereditary component. They will go through a physical exam, blood tests, an MRI or a PET scan, a neurological exam. They will do memory and cognitive testing, so neuropsychological testing, and personality testing. And all of that together, they will be able to compile enough data to determine whether there are enough symptoms to give the person a diagnosis of dementia, and notably what type of dementia. Okay, so more importantly, why is a diagnosis important? So a diagnosis will get you as the caregiver and the care receiver access to different treatment options. It will give you the opportunity to participate in clinical trials. It will provide access to emotional and social benefits. So with any programs that are in your area, so programs such as ours, support programs for caregivers, care receivers, any social service agencies that maybe have funding for, for that specific condition. It will also allow you to plan ahead. So getting a diagnosis, if that allows you to know exactly what the illness is,
Socrates.
type of dementia. Say it again.
I think she was just on the phone.
Oh, sorry. Okay, so it'll allow you to plan ahead, so to know what the exact diagnosis is and what stage it's in. And from there, you can, plan ahead, know what's coming down the pipeline, and, prepare for what's to come. And then you can get help for the care, for yourself as the caregiver and for your care recipient sooner. All right, so Jenny, you want to take over from here?
Sure. Thank you, Julie. Thank you so much for that thorough, in-depth, informative explanation of what dementia is, and then of course why it's important to understand what you're dealing with. So now that leads, so with all of this really daunting information, we're at the stage now where we ask, what can caregivers do? So we're happy to discuss that. And useful recommendations are, so to see a physician. We always like to emphasize, that there's always strength in asking for help. And as Julie mentioned, it's important to get that diagnosis because that kind of opens the door to accessing services. So, that you can, like Julie said, what's coming down the pipeline, and it's really good to be as prepared as possible before like a time of crisis, or God forbid, things get out of control. At least you have things in order. So we like to emphasize, make sure that there's paperwork in order. So that's wills, power of attorney, healthcare proxy for yourself and your loved one. We hear this a lot from elder law attorneys, the importance of having a lot of that stuff in place, what they say, get your ducks in a row, and then have everything so that there's no confusion and there's no infighting, to reduce that is always beneficial. So we always recommend joining a support group, which Julie and I run with much success in the Circle of Care for the caregivers and participants, and they benefit tremendously from it, and it's really great. They learn a lot. They support each other, encourage each other, share resources, and it's really great all around. And then of course we like to emphasize a lot with this program self-care, so taking care of your health and yourself, which is really exceedingly important when you're caregiving, because it's so draining emotionally, mentally, and physically. So we like to emphasize that there's a lot of emphasis on the self-care aspect of this program. So how PSS Circle of Care helps caregivers. So we help the family caregiver or referral partner by contacting, well, you contact us, you do an intake, and then you're assigned to a care consultant. And from there, the care consultant will learn more and schedule an appointment to complete an assessment, which is basically just some questions, general questions about health, financial status, although anybody is eligible regardless of financial status. So what happens from there is you meet, and then you develop a care plan with the care consultant. So based on whatever's going on, if you need respite, which is basically a break, we offer financial assistance, temporary and limited, but we do have that available. In typical times, we offer social adult day center, so we actually pay the fee for the care receiver to attend a social adult day center, although I don't know how long it's going to be before we'll be able to offer that. But we do offer in-home care respite, so that's paying an agency to send an aide to the home to give the caregiver a break based on need. Again, it's case by case, and it's temporary and limited, but we like to encourage people who are really, to help them prevent burnout, or maybe they're already at that stage of burnout, like totally overwhelmed. That is an option that we offer. And then of course we keep you guys informed, stuff such as this. So like you got the emails about the webinar and other events that we are hosting or taking part in, encouraging you to participate in. So basically we're a great resource. So if we don't provide a service, we most likely know of an agency or a provider that does. So we like our actual job is to link you with that resource so that you can take care of whatever needs that arise in your caregiver journey. So that's part of what's beneficial about being part of PSS. So like as mentioned before, we are grant funded by the New York State Department of Health. So all of our services are free. And no, again, anybody is eligible. So whatever financial status, we don't ask for any proof of income, or actually we don't even ask for proof of diagnosis. Although the funding is for caregivers of people with a memory impairment. So it is important that your loved one is dealing with those symptoms. So that a lot of our educational tools are geared towards that. So it really doesn't apply to people caring for someone, let's say with cancer or something like that. Although that does happen, but they have to have some kind of memory impairment. And yeah. So we have some resources, and I'll leave this screen up for you guys, or maybe you could take a screenshot or write some stuff down. There are a couple on here that aren't specific to Staten Island, so I just wanted to mention a couple that we work closely with as Staten Island care consultants. So I'm not sure if everybody knows about Community Agency for Senior Citizens, so that's CASC. And they are a DFTA-funded program, so they serve seniors 60 and over, and they do case management, so they're a little bit more hands-on than we're able to be as just care consultants. They offer case management, so they offer advocacy with like accessing medical treatment. They do in-home visits, and they manage Meals on Wheels. So for people who are maybe, especially now, who maybe can't get out to get food, they can help facilitate that with delivery of meals. And they also offer other case management services, and they're free as well. They do have a respite component. I know it's there's a waiting list in that agency, so you could speak with that about a case manager. And I wanted to just give the number, which is 718-981-6226. So that's Community Agency for Senior Citizens, again, specific to Staten Island. And then another agency that we work closely with is the JCC, which also has a caregiver support program on Staten Island, and they provide supplementals. So like they can bring you diapers and even help install grab bars in the bathroom, in the shower, in case your loved one has some vulnerability there. And they provide a whole host of other services. And we actually contract with them for their adult day center called Rosemary's Place. So when we get that up and running, I'm not sure who's signed in and who's with us or not, who's already a client, but for those that aren't, we would like to encourage you to let me get back. So to give you our number quick is the intake line for PSS Circle of Care is 1-866-665-1713. Again, that's 1-866-665-1713. So basically how that would go is you call that number, you do a quick intake, you let them know what borough you're in. And again, you can live in any borough of New York City, and your care receiver can live in, you know, another state. But because you're a New York City resident, you qualify for services, and we can still assist you even as a long distance caregiver. Or if your care receiver lives in New York and you're calling from out of state, we can assist as well. So those are some basics of how we operate. And this is just a lovely picture of a mom and a daughter. And with that, I'll open it up to questions if there's something that
Well,
you
even
feel.
if you go to the, sorry, Jenny, if you go to the next slide, I think it has the phone number on.
Oh, yeah.
8.
Okay. So there. Yeah. Thanks, Jules. So that is for anybody who maybe didn't catch it when I said it before. That is our intake number. So that 1-866 number, or you can email careinfo at pssusa.org, and somebody will get back to intake coordinator. Will get back to you. And again, from there, you would be assigned to the proper care consultant in whatever borough you're calling in. Yeah. Okay. Okay. So with that, I again will turn it over to you guys for some questions. Let me just make sure. Is anybody? Can you guys hear? Can everybody hear us?
Mm-hmm.
Does anybody have any questions?
Hello.
Hi.
Hi, this is Giselle again.
Hi,
So,
Giselle.
hi, I would like a list of medical doctors. I have been trying to get my mom to a psychiatrist or neurologist, and it's just been close to impossible to make an
Okay.
appointment.
Okay.
Who
So
can
you
speak
can.
Spanish. 1 second. I did take him to a neurologist in Staten Island, but then my mom decided that she was a big to him, and the guy just threw us out of the office and was not
Yeah.
willing to give him a diagnosis or speak to her at all.
Right. Okay. So you know what? So you and I are linked with email, so I can certainly send referrals to doctors and even a neuropsychiatrist that we.
Thank you. Okay.
Dr. Smith. Yeah, we could take it from there.
In addition, also, I would like a referral of attorneys in Staten Island. I don't think my mom has a proxy or anything like that.
Okay.
Okay, perfect.
Yeah.
Thank you so much.
Excellent. Okay. Any other questions? So I also wanted to mention, it's not listed on our slides, but if you guys go on to the website or even refer back to the email where you saw this listed, Julie and I are actually, we have some upcoming webinars. The next one that Julie and I will be hosting is April 29th, and that's actually with a licensed social worker, Rosemary Ruggiero, who owns and operates, she's the CEO of an agency called Elder Care Advocacy. So I'll link you guys to the website when I send out a reminder. So she's going to be hosting, doing like what Julie and I did today, but on the topic of a little bit more in depth about some, you know, the advanced directives, getting all of the paperwork in order. So she kind of manages she manages that. That's what she does for families. So she's going to talk in depth about that. And she probably can answer a lot of questions and, you know, about elder law attorney and stuff like that. So look forward to that. And then we have some fun stuff coming up as well. But again, I'm going to send you guys the emails, and hopefully you can register and join us like you did today. And again, I'll ask if there are any additional questions. If
Yeah,
not,
you just put it in the Q&A. In the Q&A section. And I also just want to remind everyone that the 2020 census is among us, and anyone that has not been counted or has not, you know, that has any questions about the 2020 census, those, you know, being counted is important for programs in your area, for funding purposes, just to you know, to help for, you know, to help make sure that, you know, we know that you're there, you know, and for programs to know what populations really need assistance and, you know, where funding needs to go. And that's really it. And yeah.
I don't see, yeah, there's no questions in the Q&A box. So, like I said, if
Hello?
anything comes to mind after
Hello?
this, certainly reach out to, if you're part of PSS already and you're assigned to either Julie or myself, please feel free to contact us directly for any follow-up questions or concerns. And again, if you need, I'm just going to go back to the screen quick for anybody that's new to call in or to email with, you know, receive some information about the services we provide, or any other kind of information that you might need related to your caregiver concerns. And with that, I will say thank you, and we will conclude the webinar.
All right. Thank you, everyone.
Thanks. Have a good day, everyone.
Thank you.
Okay.
Wait, we have another question. Oh,
There's a,
thank you so much.
thank you. Sarah Sue. Thank you. Okay. Okay, thanks everybody.